a visit to Bendigo Community Health Services.
Bendigo Community Health Services is a community organisation located in the local government area of the City of Greater Bendigo, with a strong connection to the community and over 40 years of local health experience. This presentation will cover a description of the range of services that Bendigo Community Health Services provide, an explanation of how public health principles are demonstrated within Bendigo Community Health Services, as well as outline some limitations of the services that can be accessed through Bendigo Community Health Services. Bendigo Community Health Services, they pride themselves for being effective in and respected for client relationships and service responsiveness, commitment to quality services and appropriateness of care, leadership in planning, service provision, governance and consumer advocacy, reputation as an employer, a provider and a partner of choice, and contributing to building healthier communities by looking forward and working towards positive change. Bendigo Community Health Service is a not-for-profit organisation that understands local health issues and responds to their consumers through a range of services and partnerships. General practitioners are available for general health services, and they also cover more specific areas such as families and children, mental health and counselling, alcohol and other drugs, sexual health, men's and women's health clinics, the LGBTIQ community, and refugee settlement and support. Services are also available for the management of particular needs through allied health programs such as podiatry and living with chronic conditions such as diabetes, respiratory or heart disease, and many more. Let's look at some of these in more detail. Bendigo Community Health Services have a range of programs and services designed to support the needs of Bendigo's population aged 55 years and over to live life well. The Women's Health Clinic is staffed by a female general practitioner and nurses. The clinic specialises in the health and well-being of women with a focus on cervical cancer screening, breast health and breast checks, bowel cancer screening, emotional and physical issues of menopause, and managing life as an older woman. The Bendigo Community Health Services also has a men's health clinic which cover issues such as cholesterol, diet and exercise, blood pressure, diabetes, prostate health, and many more. Bendigo Community Health Services offer alcohol and other drugs residential and home-based withdrawal support programs provided by experienced alcohol and drug nurses who work in collaboration with patients' own doctors. Bendigo Community Health Services have qualified counsellors who are dedicated to the improvement of the mental health and wellbeing of LGBTIQ+ people in the Bendigo community. They also offer rapid STI and HIV testing, as well as meningococcal C and hepatitis vaccines. Bendigo Community Health Services also offer family support, which helps families identify what's important to them and their children and develop a clear plan of action and support them to reach their goal. Early intervention, which cares for families with children from 0 to 6 years of age with a developmental delay or a disability. And Child Health Invest program, which helps children with complex behaviours, developmental delays, autism spectrum disorder, and much more. Bendigo Health Services Mental Health Nurse Incentive Program allows their mental health nurses to monitor and support consumers with complex mental health issues. This service is provided over a longer term and may include mental health state assessments, medication reviews, health monitoring, and connection with other services such as housing. The Humanitarian Settlement Program service providers at Bendigo Community Health Services work with refugee clients to identify their needs and goals and develop an individual case management plan. Service providers support clients to achieve outcomes in housing, physical and mental health and well-being, managing money, community participation and networking, and family function and social support, among many more. Bendigo Community Health Services have created a range of programs to help people live a healthier lifestyle by educating them to make good lifestyle choices, getting active, and lending a helping hand if needed. These services include supermarket tours, nutrition education, walking programs, strength training, social support groups, and many more. Bendigo Community Health Services have programs and services supporting a range of issues faced by young people. These include sexual health information and advice, pregnancy support and advice, contraception and advice, sexually transmissible infection and blood-borne virus testing, free condoms, and many more. The aims and objectives of Bendigo Community Health Services are to achieve better health and wellbeing across generations, to work hand in hand with the community to achieve healthier lives, to build respectful relationships through trust, empathy and collaboration, to recognise and promote accessible, safe and holistic healthcare as a basic human right, to be authentic and accountable and to honour obligations, to ensure an agile, responsive and sustainable service through continuous learning. The services that Bendigo Community Health Services provide are targeted to all members of the Bendigo community who are experiencing health issues, with a particular focus on the more disadvantaged members of the community. Bendigo Community Health Services is funded through various government health programs, community donations and sponsorships. As a not-for-profit healthcare provider, all fees are directed back into the improvement and delivery of services and programs. Bendigo Community Health Services aims to relate to public health by working to maintain a fundamental change for the disadvantaged, by promoting healthy lifestyles and preventative practices that lead to improvements in the health and wellness of the community, by providing services which enable improved individual and community health and well-being, by leading and coordinating an extensive range of primary and community health services and activities, including those provided in cooperation with other agencies and providers, and by committing to safety, quality and continuous improvement for all stakeholders. Bendigo Community Health Services have programs for equity as part of their commitment to achieving equitable health and wellbeing. These programs include reviewing existing programs to ensure that equitable health and social outcomes are achieved, using evidence to establish service models and place-based responses either alone or in collaboration with others, strengthening the focus on prevention through expanding early years and family services programs, aligning workforce capability and capacity to programs. Bendigo Community Health Services also strive for affordability by providing a wide range of primary and community health services that are free of charge or have minimal cost. Non-concession cardholders are required to pay for consultations and/or procedures and are eligible to claim a Medicare rebate. Consultation fees are based on time and complexity. Nursing appointments range from no charge for services such as respiratory education to $7 for spirometer testing appointments. Allied health appointments range from $10 for physiotherapy appointments to $15 for podiatry appointments. Programs such as pharmacotherapy are $22.50 per week. Children's specialist services range from $20 per session for occupational therapy to $950 for autism assessments. Women's health clinic services range from no charge for pregnancy tests to a $50 gap fee for skin excisions. Groups range from $6 per attendance for strength training to $20 per year for walking groups. Bendigo Community Health Services continue to work towards increasing community awareness of their services so that the community knows what they offer and how to access it. They include 4 locations spread across the city of Greater Bendigo where their services can be accessed directly. They can also be contacted through their website online, via email, through their social media accounts of Facebook, Twitter and Instagram, via mail, fax and over the phone. 3 of the 4 of the Bendigo Community Health Services locations are open and available from 8:45 to 5:15 Monday to Thursday and 8:45 to 4:30 on Fridays. The 4th in Elmore operates 9 to 5 Monday to Friday. Waiting periods for appointments are dependent on the service required, with specialist services being less available than more general healthcare services. Bendigo Community Health Services are not accessible on weekends. In 2015, the Australian Government Productivity Commission conducted a study into how public health practice in Australia could be improved. The suggestions they made were to improve health technology assessment processes and reviews, to promote evidence-based clinical practice, to improve financial incentives for better quality patient care, to encourage cost-effective investment in preventative health, to increase health workforce flexibility, to increase competition in retail pharmacy, to increase competitiveness of pharmaceutical prices, to promote a more competitive, innovative health insurance sector, and to improve information availability and dissemination. With over 200 staff and more than 50 programs, Bendigo Community Health Services endeavours to continue to work closely with their consumers and local organisations to contribute to the health and wellbeing of the Bendigo community.